So here she had been constantly chasing obesity and constantly chasing being over fat. And it was the wrong thing. She was forever on that yo-yo diet, forever on the struggle bus of losing weight, gaining weight, losing weight, and had destroyed her skeletal muscle over a lifetime. And we know that the wider the waistline in midlife, the lower the brain volume. And it's not a insult. It's not it's just like saying insulin resistance can cause multiple other problems. Well, a wider waistline can and does affect brain volume for many individuals. So it was at that moment that I realized we are, as a society, focusing, and really as a world, focusing on the wrong tissue.
Hey there, and welcome back to the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and this week we have an exceptional guest. Dr. Gabrielle Lyon is sharing her time and expertise on muscle-centric medicine with us. She received her doctorate in osteopathic medicine from the Arizona College of Osteopathic Medicine, and she's board certified in family medicine. She has studied nutrition and preventative diseases for about 20 years now, and she completed a research and clinical fellowship in nutritional science and geriatrics at Washington University in St. Louis. So we both hold geriatrics near and dear to our heart. They are a big reason for our why. And in this interview, we focus on how do we maintain muscle mass with aging? How do we prevent sarcopenia? And really, what is the key to longevity? I know that you're going to love this interview. So let's dive in. Dr. Lyon, thank you so much for joining the Reshape Your Health podcast. I know this is going to be one of my most popular interviews, and I cannot wait to share you with my audience.
I'm so excited to be here. We work with the same population, or have worked with the same population, which is incredibly unusual. And we were just talking about that beforehand.
Yeah. I want you to tell your story. End of life, right? Like you worked in geriatrics. So tell us a little bit about who you are and how you came to where you are today, your work history, but also who you help today.
Yes. So I have a very interesting kind of turn of events that led me to where I am today. I graduated high school early and I moved in with my godmother, who is a PhD in nutritional sciences. So from a very early age, I became extremely interested in nutrition, nutrition's impact on the body, nutrition's capacity to heal and help, and really what it looks like for longevity. Became so fascinated that I decided to get my undergraduate in human nutrition, vitamin, mineral metabolism. And I was fortunate enough to train under, to this day, still Dr. Donald Layman, who happens to be one of the world leading protein experts. So that really shaped my perspective and really shaped my scholarly activity. Decided to go to medical school. That's a whole nother story in itself. And then went and did 2 years of psychiatry residency, 3 years of family medicine, and most importantly, a fellowship, a combined fellowship at Washington University in St. Louis in geriatrics, obesity medicine, nutritional sciences. And that ultimately is what shaped my practice of medicine today, which I founded the Institute for Muscle-Centric Medicine. And this is the concept that muscle, skeletal muscle, is actually the largest organ in the body, truly an endocrine organ. And really the conversation of what we're talking about as it relates to health and wellness is we're all missing the mark. We are constantly being focused on this over fat adiposity issue when really the issue is being under muscled.
I love that you said it's an endocrine organ. And I want you to explain that a little bit more and explain, how learning about more end of life care, like how did it click? When did it click for you that we're focusing on the wrong thing? We have to educate and emphasize muscle.
There were two really specific moments, and I've actually publicly only talked about one. And the one was I was doing obesity research, and I was looking at the interface between midlife weight gain and midlife obesity and Alzheimer's, cognitive impairment, the domains of brain function. And I became really, really fond of one of the patients. And we spent a lot of time with them. There's cognitive testing, there's training sessions. It's very intensive because, depending on where you are in the university, the studies are very detailed and you do spend a lot with the time with these participants. And I became very fond of a mother of three. and just always upbeat and, typical kind of put herself last, her healthcare last, and put everyone before her. And we imaged her brain, and I saw changes in her brain volume, flattening of the matter of, what was going to make her tick later on in life. And it was similar to the brains that we saw in Alzheimer's. And it was early on, and it was just devastating. It was devastating that I felt as a system we had failed her.
Mm-hmm.
So here she had been constantly chasing obesity and constantly chasing being over fat. And it was the wrong thing.
Mm-hmm.
She was forever on that yo-yo diet, forever on the struggle bus of losing weight, gaining weight, losing weight, and had destroyed her skeletal muscle over a lifetime.
Mm-hmm.
And we know that the wider the waistline in midlife, the lower the brain volume. And it's not a insult. It's not it's just like saying insulin resistance can cause multiple other problems. Well, a wider waistline can and does affect brain volume for many individuals. So it was at that moment that I realized we are, as a society, focusing, and really as a world, focusing on the wrong tissue. So that was one aspect, and it was very profound for me. And that's where muscle-centric medicine was born. And then the other aspect of muscle-centric medicine is really working with the geriatric end-of-life palliative care patients. That, if anyone has done it, any physician, any practitioner, it is devastating. And I found it incredibly, I worked in a nursing home for 2 years, and I just, I found it incredibly devastating.
I think that it's almost too little too late at some point. It's never too late, but you're just faced with these people with a really low quality of life.
Terrible.
And feeling like I have all of this education I want to give them, but even if I did, they didn't have the capacity to implement. They didn't have the physical or mental ability at that point to follow through on what it was going to take to really improve their health. So I think our why regarding preventative healthcare and really getting to the root cause of disease and preventing that just aligns so well. So that's why I'm so excited to have you on today.
Yeah. And it's devastating because as providers, we're not seeing a parent. It's not just one person. I watched my grandmother die of Alzheimer's, and we were very close, but this is patient after patient. This is hundreds of patients, over a career. You see 30 patients a day over 2 years, you can calculate how many patients that is.
Right. I want to know too, you said we're missing the mark. We're focusing a lot on fat tissue and not so much on muscle. So can you explain a little bit more why chronic yo-yo dieting kills our skeletal muscle and why it's more beneficial, more effective to focus on building muscle more than burning fat?
Right. Well, one thing is, it's kind of as if you have a problem and you focus more on that problem, you don't actually come up with a solution, you come up with more of a problem. Skeletal muscle is really the organ of longevity. And when you think about its importance, you think about as it relates to glucose disposal. Essentially what that means is it regulates everything about our metabolism. Everything is extreme, but really it's the primary site for glucose disposal. And the body really only has one other way to deal with elevated levels of blood glucose, and that's insulin. So you don't want that. You want to utilize skeletal muscle. You want to utilize the activity to then move the blood sugar, right? Remove glucose from the blood to skeletal muscle. The other aspect of skeletal muscle is it is the amino acid reservoir. As we age, there's an increased risk of infection. There's more of a catabolic state. We have low levels of inflammation. The body utilizes skeletal muscle, the amino acids from skeletal muscle, when you're not constantly feeding. You are utilizing these amino acids in time of need. And that's really important. And we know that the more skeletal muscle mass an individual has, the higher their survivability. And that is really, really important, because it's not that something bad is going to happen, but you have to prepare your body to be able to withstand the storms of life.
I think
that does happen.
COVID, we're in a pandemic still. And I think that that's really evidence that it's affecting people who are metabolically unhealthy more. They're having more serious complications and hospitalizations, unfortunately. So I think it's a little bit of a wake-up call Like, hey, I got to prioritize my health. And I think I hear that a
Absolutely.
lot from women of like, I'm ready to make a change. I'm ready to put my own health first. You mentioned the mom of three, how she was
Oh,
constantly putting the
yeah,
needs of others ahead of herself. And I think that's a big barrier for women.
it
And
is.
it sometimes takes a wake up call, like, hey,
Yes.
you're pre diabetic, or hey, if you don't make some changes, we're going to have to start you on a medication, or hey, you
And
have signs of Alzheimer's already.
ugh, and perimenopause, menopause time is really, while the evidence isn't totally clear, we do know that body composition changes. It doesn't happen to everybody, but one of the most common things that I see in my clinic and treat is midlife weight gain.
Mm-hmm.
And do we know, can we correlate this estrogen level and this testosterone and this progesterone level with a correlated amount of weight gain? We cannot. However, we do see there is a change in fat distribution. And again, this is not for everybody, but there's a change in fat distribution where we see more visceral fat, fat around the organs, more central adiposity. And, we do see a decrease in skeletal muscle.
Mm-hmm.
And
And
this, we see increase in sarcopenia,
yep,
which is a decrease in muscle mass and function, which you see probably every day if you're still taking
yep.
care of patients. And we see subsequent metabolic changes. And then there's these physiological changes that happen to skeletal muscle as we age. And this is called anabolic resistance. And this happens to everybody. What this means is that the muscle becomes less efficient at utilizing protein. In essence, skeletal muscle is a nutrient sensing organ, which is fascinating. It
Mm-hmm.
is a malleable tissue, an endocrine organ, which has components and responsibilities in the immune system, and is also this nutrient sensing organ. And its ability to sense nutrients, in particular protein, decreases as we age. So we must account for this if we are going to change and if we want the trajectory of our aging to improve and to be exceptional, we have to modify the way that we trained and the way that we ate in our 20s to account for this changing hormonal milieu with a decrease in hormones, as well as the physiological changes that happen within skeletal muscle.
So what are those changes that we need to make? I think that there's a lot of myths. There's major experts out there that are giving bad advice on how much protein we need to be eating for optimal aging, optimal muscle function. So what is the big picture on, okay, muscle-centric medicine? We're on board. What does that look like?
The big picture is, well, first, before I tell you the big picture, I think we have to qualify these experts. If an individual is not professionally trained in nutrition,
Mm-hmm.
I think that we have to rethink where we're getting our nutrition advice. And it, has taken me decades to train, professionally. I trained 17 years of higher education.
Mm-hmm.
There has to be some kind of ground rules for who is considered an expert and who is not, because otherwise information becomes very poorly distributed. It becomes very biased. It becomes misinterpreted. So I will just say that.
Mm-hmm.
As it relates to anabolic resistance and sarcopenia and aging, we know the evidence is very clear that we need more protein as we age, not less. And what that can look like is, if you think about the RDA, which is the recommended dietary allowance, is 0.8 grams per kilogram, the evidence suggests that we should be doubling that, anywhere from 1.6 to 1.8 grams per kilogram. The way that I think about it is 1 gram per pound ideal body weight.
Yep.
The reason that this becomes so important, and you have to eat it in discrete meals, the reason that this becomes so important is that we know that we can improve the efficiency of skeletal muscle by bolusing protein, meaning if we're eating protein 30 to 50 grams per meal, not per day, 30 to 50 grams per meal allows for mTOR to begin to signal, mTOR to turn on, have enough protein, have all the amino acids necessary to lay down new protein. Mm-hmm. So essentially, older muscle becomes as efficient as younger muscle by increasing dietary protein at one time per meal.
And you said discrete meals, and I think that you clarified what you meant by that, but that's a bolus of protein. And what's an ideal level in your opinion? Like 3 meals a day, four, how many
Great
boluses do you
question.
need?
So it's a great question, and there's multiple ways that this can be done.
Mhm.
Most important is that an individual understands that they need to get a robust dose of protein per meal. As an aging individual, we know that they don't eat as much. And we've seen it. There's trouble with mastication. They just don't have a big appetite, low levels of inflammation. There's all kinds of things, poor dentition, that create issues with feeding. A great way to do it is to think about what is that ultimate protein goal. 1 gram per pound ideal body weight. Most older individuals don't eat. However, perimenopause, menopause women are still able to consume that. So it's slowly shifting the amount. I love to see a minimum of 30 grams per meal. At the upper end could be 55, not really much benefit to do more than that, but you certainly could. You can, depending on what your goal is, for example, if it is muscle maintenance, you could easily do 2 meals of that 50 to 55 gram target. If you're looking to put on skeletal muscle, now you're looking at stimulating muscle protein synthesis and stimulating mTOR more times during that day. That could easily be 4 meals. So 4 meals if you're looking to build muscle, 2 meals if you're looking to maintain and lose weight.
That's great advice. And that's pretty much in line with what I recommend too, especially combining intermittent fasting.
Mm-hmm.
And so, in your opinion, I wanted to talk about protein recycling because that's kind of a hot topic. Will you tell us what protein recycling is? And first of all, let's just start there and then we'll do some follow-up.
Okay. Let's define what I believe that you're talking about is the ability to use amino acids and continue to use them for other aspects in the body.
Right.
So there's essential amino acids and non-essential. The body can utilize and quote recycle many of the non-essential amino acids, like glutamine. Body can utilize glutamine, can utilize that for multiple purposes. It's the most abundant amino acid. Now, what I think that you're getting at is this concept of gluconeogenesis, of taking protein, breaking down the amino acids, and generating glucose. There's a couple reasons why that happens. And we will say that the number one reason would be gluconeogenesis. And this is to maintain blood glucose levels. So specifically, what does that mean? For every 100 grams of protein, you'll generate 60 grams of glucose, roughly. And that is through the process of gluconeogenesis, of utilizing the carbon and breaking down the bonds. The body will utilize this. The body will utilize this not just for skeletal muscle, but for organs. We'll use it for all tissue. Protein turnover is roughly 250 grams per day.
That's
the body is the majority of protein that we eat actually goes to protein turnover.
Interesting.
Which is the system that is just constantly breaking down, building up, repairing. So, however, we always focus on skeletal muscle, but that's only a small part of protein turnover. It's in every process in the body.
I wanted you to touch a little bit more on leucine and why you give that 30 gram threshold a minimum. Why is that? Why is 30 grams the minimum?
30 grams is the minimum because it's the minimum amount. Typically 30 grams of protein correlates to 2.5 grams of leucine. Leucine is an essential amino acid that's really required for muscle protein synthesis. Now, muscle protein synthesis isn't the end all be all, right? But we know that over a period of time, as you continue to stimulate it and you get enough amino acids and enough protein, you begin to lay down tissue. It's the best that we can do as it relates to studying and determining in clinical, research what it means to lay down skeletal muscle. Leucine, 30 grams of high quality animal-based protein or whey protein typically equates to 2.5 grams of leucine. That is what is needed at a minimum amount for an aging individual or a more mature individual or an obese individual to stimulate muscle protein synthesis. And when we think about aging, we really need to think about the health and longevity of skeletal muscle. It's not just about having skeletal muscle. Skeletal muscle can be infiltrated with fat. It's having skeletal muscle that is healthy, right? Yes. We want our marbled steak to stay a steak. We don't want marbled tissue.
Right. Yeah. Marbling isn't necessarily good in our skeletal muscle like it is in our steaks. Yes.
And it becomes very complicated when you have to think about, well, how much leucine does this have? Should I just take leucine? And it doesn't quite work like that. When you take leucine alone, you deplete the other amino acids. There's leucine, isoleucine, and valine, and they all work together. It is much better to either take a high quality food like a beef or a bison or a chicken, or if you're going to have a more vegan or vegetarian option, to add in a scoop of branched chain amino acids.
Okay.
Now you have the complete protein set, which is what is necessary for
Will you-
stimulating tissue.
Will you talk a little bit more about the branched chain amino acids? Do
Sure.
you have any specific recommendations for like which brand you prefer
Yeah.
and how often and
Mhm.
the best way to eat them, I guess, to make it palatable?
So I recommend First Forms,
Mhm.
and you can put a link
I
in
will,
the show
yep.
notes for that. And how you utilize branched chain amino acids can be done in a few ways. Typically, I recommend them for anyone who is older or looking for calorie restriction. What does that mean? An individual, how do you define older? Or they could even be injured. So if someone is sick at home, someone is not able to get enough protein, then, if they're going to have one egg, I would recommend also a scoop of branched chain amino acids. So now you've got the protein from the egg, but you're also utilizing branched chain amino acids. Branched chain amino acids alone will not build muscle. Branched chain amino acids in conjunction with a full set of protein, full set of amino acids will be able to augment muscle growth.
Mhm.
If an individual is vegan or vegetarian, I'd like to see, again, if we're talking about maintenance of weight, twice a day, use your branched chain amino acids. If you're having quinoa, or if you're having, say, soy or beans and rice, whatever you're having, add in a scoop of branched chains. It will allow you to keep your caloric load low while adding in the full complement of amino acids.
Okay, so that's one of the main differences then between plant-based and animal-based protein would
Yeah.
be some of the leucine, for example. And then you can
Yes.
supplement that with the branched chain amino acids. We'll link to the First Form in the
Yeah.
notes on YouTube and in the blog post. I wanted to talk a little bit more about your opinion on quality of protein. So one of my members wanted me to ask specifically about grass versus grain-fed beef, and then wild caught versus farmed fish and the nutritional profiles of those meats. So can you elaborate a little bit more there?
Yeah, certainly. And I actually, on my YouTube, I'm going to have an expert in this subject, and he's very, very interesting. Number one, price point should not deter people. I am okay with individuals eating conventionally raised beef, and I'm also okay with them eating organic grass-fed. Organic grass-fed can be extremely expensive. Do I think that is the only kind of meat an individual should eat? I don't. I feel like the USDA and Beef Checkoff does a very good job at regulating the cattle industry. Majority of cattle are raised on pasture, and there's bad practices everywhere. So just like in any industry, it's not to say that that is the norm. In addition, when you look at some of the data, the protein quality is largely the same. The one thing that people talk about is conjugated linoleic acid or omega-3s, and you're not eating meat for that. So whether it's a difference between a 0.1 milligram versus a 0.8 milligram, that's not why you're eating red meat. That's not where I would suggest that you get your omegas.
Right. Yeah.
And as it relates to fish, from what I understand, there's not as big of a difference as we would think.
Okay.
And again, I am not the expert on this. I will definitely be having an expert on my YouTube channel about this. And, we have to really think about the cost benefit analysis. So for example, if someone can't afford salmon, if they can't afford wild caught salmon, are you going to say, I'd rather you not eat salmon? I wouldn't say that.
No, me either. Yep.
And the regulations are very strict in terms of what can be used with beef, in beef. Unhappy animals don't grow,
Yeah.
right? Mistreated animals don't grow.
Yep. It's true.
We see that with children. We see that with all animals, right? Humans included. Mistreated individuals don't grow.
Yep. I think you have so much good content on your Instagram. If people are watching or listening and they don't already follow you, I'll be sure to link that up. But you always just kind of lay it out there I love two of your posts specifically. It was a protein ball and then a protein ball, like an egg versus, this calorically dense, sugar, protein ball. And then the other one was ingredients in a real steak versus a fake steak. And I just thought
And
that
people
was
are very emotional
cute.
about it. And, I have been 20 years in. So this is 20 years into the game for me, 20 years of nutritional sciences. And, a decade ago, this was never an argument. This is only newer arguments. I mean, there's arguments about cholesterol, and the cholesterol story is that the body makes cholesterol. If you care about cholesterol, you're going to watch your insulin and excess carbohydrates. But when calories are controlled, saturated fat is not an issue. The body has a cholesterol set point.
Yes. And we've talked a lot about cholesterol because that's a huge barrier. I was going to talk about what are the barriers for your clients for getting enough protein. And one of the ones that I come into is, well, I'm afraid to eat more animal-based products because my cholesterol is going to go up. And I've had experts on, I've had experts on to talk about that issue. And it's like, if you're only focusing on total LDL and total cholesterol, you're way missing the mark. And eating saturated fat can help HDL actually go up. So there's
hyper responders, and those people shouldn't be eating high fat diets.
Mm-hmm.
But they should go to a cardiologist and get risk stratification. We have an amazing cardiologist in our practice, Dr. Michael Twyman. He would be great to have on.
Yeah.
And individuals think of cardiology as a older man's sport, but it's a young man's game, right? Cardiology is not an older man's sport. You have to really think about risk prevention early on. But some individuals are hyper responders to high fat diets, and they probably shouldn't be on it, but it's a full risk stratification, right? It's a calcium score, it's imaging, it's carotid imaging. It's not just here's your LDLs.
Right. And then here's a statin if they're high, which is unfortunately sometimes the standard that we're living in. And that's hard. That's really hard in geriatric medicine as I enter people's, medications and I have to put a statin and then I have to put the indication and it's high cholesterol. And I know I'm like, this is BS. I'm putting this in and that's like why I love having this outlet to really put good quality information out into the ether. Cause it makes me feel better about that line item that I have to enter. Cause that's my job.
Yeah, totally. And statins are really bad for muscle health.
Yes.
But then again, if an individual needs it,
Well, I want you to talk about that because I talk openly about statins being bad for muscle health, how they increase insulin resistance often. So can you talk about statins specifically, how they harm muscle health, or at least in some people, they might do that?
Well, the number one reason why individuals discontinue a statin is because of muscle pain and muscle fatigue. And clinically, I see this all the time. So that individuals are put on statins that don't necessarily need statins or have a calcium score of 0 or, have no other risk factors. And I think that's where it becomes really important to educate the patient and the public in terms of, is that an appropriate medication? Hey, a low dose statin for a short period of time to lower inflammatory markers could be okay. But again, this is when you need to really work with a good cardiologist. I personally don't think that primary care physicians should necessarily be risk stratifying and putting individuals on statins. I think that you really need a good cardiologist or a lipidologist or someone to actually do risk stratification. Because what ultimately happens is if you don't need a statin and you're put on a statin, then you see training capacity decrease all the time. People just don't feel like training or they suffer through pain and they don't seem to recover as well. And we know that once skeletal muscle goes, then metabolically, it's totally unfavorable, right? Blood glucose goes up, insulin resistance increases. We see all kinds of things. Triglycerides go up. It becomes a whole downstream effect.
It does. I'm glad that you touched on that. And speaking of insulin, this was something I wanted to be sure to touch on. Explain, I talk about macronutrients a lot and how, starches and sugars will cause the greatest glucose and insulin response. Protein has moderate, fat has the lowest. And then there's different subcategories of, which types of macronutrients under the umbrella are healthiest. But talk about protein and how insulin responds to a protein meal, a high protein meal.
It's interesting. People talk about why they should just eat a high fat diet because of this insulin response. So, fat doesn't increase insulin. So people should not eat carbohydrates and should not eat protein because of insulin. Wrong. I mean, that's just silly, right?
Yeah.
There are insulin. So insulin is increased by carbohydrates and by dietary protein. However, it is not to the same effect and it's not in the same way. And number one, I will tell you that carbohydrates need to be thought of in a meal threshold. For example, for my patients, I recommend 40 to 50 grams of carbs to not exceed that per meal. And again, I typically am a lower carb individual. 90, could start them at 90 grams and decrease from there, right? You see what an individual's carbohydrate tolerance or preference is. Anything over 40 to 50 grams of carbohydrates creates an excess insulin response, right? And the body has to dispose of that insulin. So now it, creates, some goes to liver glycogen and, multiple other places of disposal, skeletal muscle, obligatory use from organs, brain. It becomes more challenging and an individual requires a more robust insulin response. Protein, on the other hand, is it's a phase one response only, whereas carbohydrates is preformed and then the pancreas has to make insulin.
Mm-hmm.
Protein is a phase one insulin response only. So it is only what is pre-made. And typically the reason that happens is it helps with muscle protein synthesis. So it's not a bad thing.
Mm-hmm.
And clinically, individuals that eat a high protein diet all have low insulin. So they eat a high protein diet, their blood sugar remains a little bit higher because it remains stable through the process of gluconeogenesis that we talked about earlier. And this is the body's own ability to maintain its blood glucose.
Mm-hmm. I talk a lot about a low insulin lifestyle, but if you're only focusing on insulin, you're missing the protein mark because they're called essential amino acids for a reason. And just like you spoke of, you have to get enough leucine and enough of the other amino acids to really build skeletal muscle, which increases the room that you have to deposit that excess glucose, and improves overall metabolic health. So I don't think that you can only focus on one thing. And I think you're really good about talking about that. You have to look at the risk stratification. Right. You have to look at other factors going on. And so speaking of that, I wanted to talk about building muscle. One of my favorite quotes from you, I quote you quite a bit in my program on this, is, you can't out exercise a bad diet, but you can't out diet no exercise.
Right.
And I love that little caveat on the end, because a lot of people, from a time management, maybe they don't have the energy to exercise, they try to out diet and you just can't. So talk about why exercise and what specific types of exercise are crucial if we want to build and maintain healthy muscle as we age.
Right. So this is resistance exercise. And it's really interesting. The data would support that exercise actually in resistance exercise has a bigger impact on metabolism and overall body composition than nutrition.
Whoa, I need you to say that again, because now I really need to go lift weights this afternoon. So say that one more time.
So the data supports that exercise, resistance exercise in particular, has a much bigger impact than nutrition, which is fascinating. Yeah. Because right now there's this dichotomy, right? We have people that are really interested in weightlifting. And, it's interesting, Morgan, because individuals kind of in the older space, the more mature space, they're not thinking about resistance exercise. Mm-mm. So we have this talk about longevity, and then we have this dichotomy of the kind of fitness crew, CrossFit crew, let's lift heavy weights, and then the nutrition crew. So it's all these different kind of components or groups, but there's not an interface between the two, which is fascinating. And one of the reasons I was really excited to talk to you, because you actually are interfacing. You're one of the few people that is really focused on older activity and older movement and physical activity, which I think as a group is completely ignored.
Yeah, it is. And it's so my biggest pet peeve is seeing underdosed geriatric physical therapy. And one of my favorite
I can imagine
from a geriatric physical therapy textbook is the only reason that we should have older adults sitting and kicking their leg is if their goal is to kick a ball from a seated position. That's the only reason. And so if I walk into a therapy gym and I see people with ankle weights on doing isolated joint movements, I'm immediately questioning that therapist. And, on the inside, maybe not on the outside. Right. That I'm like, come on, get your patients up, do multi-joint movements. I think it's really important. I'd like you to touch on the intensity of exercise and the frequency of exercise. From your practice, what do you recommend for resistance training regarding how intense should it be? How frequently do we need to be doing resistance training for optimal results?
Yeah. And this actually comes from Stu Phillips' lab at McMaster's University. They've done a really good job. He's an amazing scientist. And his data would support that it's about exertion. It's not about the heavy weight. I, early on in my career, said, man, everybody has to lift heavy weights, but it's actually about exertion. It's about going to fatigue. And whether that's 15 or 20 reps, depending on your age, right? Listen, is there a great rep range? Volume matters. So could you do 12 to 15 reps? Could you do multiple sets with, hitting each muscle group twice a week? Totally. But could you do lower weight, higher volume, and still go to fatigability? A perceived exertion that is you're done and it's really hard. Then for older individuals, that also works. Or blood flow restriction.
That's an interesting one. I'm not using blood flow restriction because I just do home care admissions. And so I don't really get to do the training side of things right now, but I have had people, I've seen it done. And then I've looked into the research on blood flow restriction exercise, which I think is really interesting. Yeah. So you're saying, even if it's a higher frequency or like a higher rep, like 20 reps,
it's all about how much exertion. So it is about volume and it is about exertion. Which is interesting because I didn't believe that for a very long time until I saw some of his data. I really thought it was, we have to push these people to do, whether it's 40% their 1 rep max or whatever it is, but that's not actually, it doesn't have to be that.
It has to be to fatigue. And I like to say, I think like a 10 to 15 rep to fatigue is really doable for most people.
Totally.
And it's not high enough for older adults that they're going to be at a risk of injury. They're going to kind of catch it before that. Well, I want to know what your personal training regimen is like, because I see on Instagram, you and your husband do you have a home gym with quite a bit of equipment? What's your favorite go-to exercises, or what's your personal training regimen? I think you said you have a 5-month-old son, right?
I have a 5-month-old son. Yes, I do.
So that might change things a little bit.
Yeah.
She has a daughter too.
And a daughter and a 2-year-old. So for me, I think that intervals. So right now, my cardiovascular base is not great. For me, I'm doing a little bit more time. So 45 minutes of cardio a day plus kettlebells or some kind of resistance exercise. Normally I would be in and out in an hour, but because I am struggling to get kind of my cardiovascular base back, I'm doing it what I can do. So I'm actually putting in a little bit more volume. I have an Airdyne. So I use the Airdyne. We have a rower, Stairmaster, which I actually really like if I go to the gym, and then kettlebells, a lot of kettlebell swings, a lot of pressing, a lot of glute bridges, really starting to get that base back. I trained through my whole pregnancy. Yep. But, with the no sleep and everything as a whole.
It's a deal. And your hormones get all off and your growth hormone declines with poor sleep. I think it's, going through postpartum, I'm like, I understand why women would gain weight in this season of life and not get it off and really, really struggle. Because
I actually have not thought about that. Yeah. It's probably a good point.
I can get it. Because if you're not sleeping, you don't have as much energy to follow through. Your hormones are off. You have more hunger, less satiety, more cortisol. I'm like, oh my gosh, just the stress in and of itself can cause the weight gain. So that's kind of interesting. I've always wondered what your training regimen was like. And then I always think of you when I have eggs. So I heard once that you have 5 eggs for breakfast. Is that still true, or do you ever mix it up?
So I've been skipping breakfast. Okay. I've actually been skipping breakfast.
Yep.
And so I'm a little burnt out on eggs because I swear we eat eggs every day.
Yeah.
It's so easy. It's the go-to. There's a lot of choline in it.
Yeah, it's funny, but I was just like, okay, if Dr. Lyon is eating 5 eggs for breakfast, I know some people respond differently, but that's got to be a really good sign that they're a healthy food and that you don't need to worry about the cholesterol in the eggs. And we've already kind of touched on the cholesterol. Yeah.
And I have a great post on that if individuals want to read that, about
just go through. Yeah. Your Instagram posts are awesome. I'm like, those must take her forever because
they take me forever.
Yeah. People do not understand how much time it takes to create a really good Instagram post or like a really good video or interview. So I'm really thankful.
And I write all my own stuff. I'm sure you do too. Cause it comes from original thought.
Yep.
And I think that that's really important to understand, that if people start seeing repetitive information, then you always have to question, where is that coming from?
Yep.
Oftentimes, as humans, we repeat things frequently, and we repeat them so much that we believe them to be true without questioning them.
It's
And I
just
think
like
that
the
that's
calories
very
in,
important.
calories out. It's like just because something is repeated often enough doesn't make it true. And I think that's really important when it comes to nutrition and weight loss science specifically, and exercise, how like we believe cardio is king and it's about calories in and calories out. And it's like, no, the quality of your food, the quality of your exercise matters a lot. And so I think it's important to question, I think that's a mindset piece that I teach. And I'd like to finish with that with you with mindset tips. I think mindset is so important and so overlooked in the weight loss industry. People want quick fixes. People are not trained to have delayed gratification regarding their results. And they're used to these crash diets that show fast results. They're doing the quote unquote right way, and they're not seeing results as fast, and they get frustrated and they feel like they're doing something wrong and like their metabolism's broken. And it's like, no, this is a mindset block and you can get over this. But what are the biggest mindset blocks that you see in your practice that prevent people from reaching their optimal level of health? And how do you recommend they get over
The
them?
number one thing is you must prepare for your weaknesses. You cannot be surprised by human behavior and human predictability. As humans, we are predictable.
Yeah.
When you plan for your weakness and you're not surprised by it, if you know you get stressed, or if you stay up late watching a Netflix show, you're not going to go to the gym at the time that you said. If you know that when your daughter comes home or your son comes home, you're not going to train. Typically, you have behaviors that you repeat over and over again, and they're deeply predictable. Yet each time we're shocked that it's happening.
Right? Yeah.
When you plan for that, you can circumvent it. So you know that it's going to happen. You plan for it. You've rehearsed in your mind what you're going to do instead. And you initiate the things that need to happen to execute in a way to become the person you want to be.
Planning and then executing in your mind first.
Yeah. And really understanding your weaknesses. Everybody focuses on strengths. We're in this very happy, let's all focus on positivity and our strengths. And that's a mistake. Your strengths aren't going to get you better.
Yeah.
You're already good at that. It's really, really knowing where you fail, and also being and having personal integrity. When you have a promise and you made the promise to yourself, nothing is going to erode your self-confidence faster than breaking promises to yourself.
Yep. I think
really putting in those pieces of knowing your weaknesses, understanding that this is a personal integrity issue. Then once you put those into place, there's less wiggle room for excuses. And, it doesn't necessarily, a new habit it doesn't become easier. You lose motivation, but you execute anyway because you've made a promise to yourself.
Absolutely. I like to remind people you're already accountable. You're already dependable. Like look at your performance at work, for example. Do you go to work every day, even though you don't want to? Probably. Are you being consistent in other areas of your life? Yes. Like you have the tools and you have the ability. We have to translate that to your personal integrity towards your health goals, so just kind of reminding them that it's already in you, but you need to learn how to transfer it for you, not for someone else, but to show up for you.
And there's one more piece to that, and that is the narrative.
Tell me more about that.
There should be no narrative. Everybody has a narrative about, well, I'm already overweight, or, oh, I can't do this, or, oh, I have Hashimoto's, or, oh, I'm going through menopause. It's never going to get better. Whatever the narrative is, you have to mitigate that.
There should be no narrative.
There's no narrative. You're going to have one. But the people that I take care of, I'm the private doctor to leaders, innovators, and mavericks, really special group. And one of the things that they all have in common is there's literally no narrative. I had one, I have one SEAL in my practice. I mean, I have many SEALs in my practice, but I have one SEAL in my practice, and he was home on friendly soil, and he was struck by a 17-year-old girl texting and driving. And he loses his leg. So this guy spent 20 years in the teams to some of the most dangerous places on earth. He's in my clinic, and I was like, hey, dude, how are you doing? And he's like, oh, well, doc, I'm a little tired and I can't really sleep. I'm having some phantom limb pain. I'm like, no, no, no. How are you doing? He looked at me and he's like, Doc, what are you talking about? I go, I mean, here you are, this big, tough dude, strong guy, and you lost your leg. And now you have to do all this stuff. And I went on this whole narrative. Next to me, he goes, Doc, that was 6 months ago.
So,
No narrative. If
no
anyone
narrative.
could have had a narrative, he totally could have had a narrative
Yeah.
about why it wasn't fair, how much pain he's in, how he can't work out, like anything. And most of us, we can't even get over stuff that happened 2 years ago. Still talking about it.
Yeah. And he lost a leg 6 months
Look,
ago.
he literally lost a leg.
Talking about, yeah.
So I call my husband because they're friends. I call my husband. I say, oh, hey, so-and-so was in the office because they were talking anyway. And he said it was okay to tell him. And I said, he was sitting there and I tell my husband the whole story. And Shane goes, yeah, babe, what are you talking about? That was 6 months ago.
It's incredible.
Right?
That mental resiliency is really
But both of them, they both looked at me
Yeah.
like I was the crazy one. The whole point of that is there was no narrative.
Right.
It was, what do I have to do to execute the things? Everything else was just noise and distraction.
Yep. I
So
think that's
becoming
awesome.
very familiar with whatever your narrative is and not believing it. Everybody has a narrative. It doesn't mean that they act on it. It doesn't mean that they're thinking about it. Yeah. So understanding your weaknesses, really preparing for them, realize that human behavior is totally predictable, having personal integrity, and mitigating any kind of narrative. Those are the three things that I would say
Yeah.
on my highest performers, the highest performers that I see over and over again.
Thank you for sharing those. Those are new ones to the show. And I know that this episode is going to be so popular. I think that there's going to be just a warm welcome reception to the science that you're sharing. Can you tell people how they can learn more about you and where they can learn about your programs and services?
Yeah. So you can find me on my website, Dr. Gabrielle Lyon. If they're interested in becoming a patient, you can apply. I'm very active on my YouTube, which is Dr. Gabrielle Lyon. I talk with my mentor of 20 years. We talk all things science. I'm going to be having more people on, which is really fun for me. And I have a newsletter. The newsletter I highly curate. I write everything. I pick everything. And that'll have this episode on here. It just has a whole bunch of different things. And my Instagram, of course, I'm very active on Instagram and I write everything there too.
It's amazing. You're putting out such good content. We're so thankful for your expertise and your time today. Thank you so much, Dr. Lyon.
Thank you. Thanks for having me.
Yep. I'll talk to you later. Bye.
Bye.